All right, so let's talk about 3 exercises that we can do that will have a major impact on the pelvic floor. So pelvic floor definitely responds to the position of our hips, and it also responds to our breath. And so I'm just going to try to take a couple of those movements, just thinking breath and where your hips are sitting, and just try to make an impact on your pelvic floor just by simply doing those 3 exercises. So you can think about this as like a 3-minute challenge for your pelvic floor if you want to. Each of these 3 exercises, I want you to just spend a minute doing them and do them every day for a week, or maybe every day for 2 weeks, and just see if it makes a difference in what you're feeling in your pelvic floor. So if you're having pain in your pelvic floor, or maybe you're having some stress urinary incontinence after having a baby, or maybe you just feel like you're just disconnected to the pelvic floor. You don't even know what your pelvic floor is doing. So these 3 exercises can help with all of those things. And so let's get right into it. So the first one that we're going to do is we're just going to work into a squatting position. And I definitely recommend having something to hang on to, especially if you're not a pro at doing squats, because I'm not really making this a balance exercise. It's really about lengthening pelvic floor, getting your hips in the right position, and just breathing. So position your feet at shoulder width apart or a little bit farther. Main thing is that I just want to keep them steady and in position. So I don't want your knees coming in. I want you to be in a position where you can naturally fall into a squat. So hanging onto the counter or bar or whatever you have handy, go ahead and position your hands. And then I want you to try to maintain that neutral pelvic alignment all the way through the squat. And so a lot of times it's easier to show you what not to do. So I don't want a lot of butt tucking so that when you go down, you're super rounded in the back. And I don't want you too arched so that you are doing this number as you go down, right? So think about your back and just keeping that nice neutral position as you come into a squat, okay? All right, so here we go. Just gonna exhale to bring on our core. And then we're just gonna move into that squatting position. I want you to inhale as you go down and exhale as you come up. So inhale and exhale. And so on the inhale, our pelvic floor lengthens. And on the exhale, pelvic floor responds by contracting just a little bit. And so by just doing this exercise and only thinking about your breath, can kickstart that whole system, because diaphragm signals pelvic floor what to do. Sort of pelvic floor responds to what the diaphragm is doing. And so do 10 of those, or for a minute if you want to set a timer, because we're sticking with our minute exercises. And when you're done with that one, we're going to move into a deep squatting position. And so for this position might be difficult for some people. It's a little bit difficult for me just because of some tightness that I have in some areas. But have something to hang on to. So you're going to want something low to the ground to hang on to, like the leg of a chair, a heavy chair, something that's firm and that won't give way on you. So we're going to move into that squatting position. I'm going to grab the bottom of this table so that I can maintain my balance. Once I'm in this position, you can see my back is very rounded and stretched out. Feels really nice actually. And I know I'm not going to tip over because I've got myself anchored here. Once I'm in this position, I'm going to focus on my breath. I'm just going to do nice long inhales. And nice long exhales. Inhales. inhales, breathing into my back, and then exhale. And I want you to hold this position for a minute. Just breathing, just trying to relax into that position. Hopefully breathing deeper each time. Then you're going to squeeze your glutes. Come on up from there. So that's exercise number 2. The third one is just a little bit more detailed, but still a pretty simple exercise. So you're going to grab a stretchy band, so some TheraBand, or whatever you have at home that's stretchy. And position yourself where you've got just a little bit of tension on the band. My back leg, or my outside leg here, is going to go back, front, and my left leg is going to go forward. I'm going to move into like a modified squatting position, just a little bit. Knees are bent. The back foot, I'm going to come up on my forefoot, so my heel is off the ground. And I'm going to bring the band to my center. My right leg, or the leg nearest to the camera here, as I go into my squatting position, I'm going to let it rotate in. Yep, and then I'm going to squeeze glutes. Come back up to neutral. So I'm going to inhale on the way down. And then exhale as I push up. And I can even rotate out just a little bit into external rotation. Okay? So inhale. And exhale. Inhale. And exhale. This exercise can be somewhat challenging, but definitely make it quality movements versus quantity movements. Remember, the challenge is just to do it for a minute, so make them count. Let me do one from this angle. So I'm going to have my right leg back this time. Okay, position my pelvis. All right, I'm going to inhale as I move down, and exhale as I rotate up and out. Okay, inhale and exhale. And these are all wonderful pelvic floor exercises. So my challenge to you is to give these a try. And after a week, maybe 2, just doing those 3 simple exercises, 1 minute each, every day, or at least 4 or 5 times a week, and see if you don't, number 1, start to become a little bit more connected with your pelvic floor, more aware of what you feel down there, the lengthening, the contracting, and how that coordinates with your breath. And number 2, you'll start to see that your hips feel looser, more mobile, you have a lot more flexibility, and even feel a little bit stronger in your core. So these things can happen sort of organically by just starting to stack the pieces of the coordination of breath and pelvic floor and core all together. And you don't even have to really overthink it. You just have to get active and start doing it. So hope this helps. And please comment, let me know if you tried these exercises and how your body responded. And if you need more help, you need more guidance, find yourself a pelvic floor physical therapist and get moving and get that pelvic floor rocking and rolling today.